If you or someone you love is heading into that second trimester, that stretch of pregnancy, you might have heard about the gestational diabetes test screening. It's a pretty standard part of prenatal care. But what most people don't realize is that, like many things in pregnancy, there are actually options when it comes to how this test is done. Let's break it down together so you can feel informed, empowered, and maybe even a little more relaxed when this appointment pops up. Love and blessings, beautiful people. My name is Elizabeth Van Dwelt. I'm a holistic doula and a women's health coach currently residing in the prairies of Canada. Everything said in my videos are for educational purposes only. I'm not handing out medical advice because I don't have the authority to. So please do your own research, consult a healthcare professional if you so choose, and let's dive in. So what is gestational diabetes, or GD, anyway? First off, gestational diabetes is a type of diabetes. It normally develops during pregnancy, usually around 24 to 28 weeks. It happens when the body becomes more insulin resistant. This is a natural shift that can happen during pregnancy, but for some, the body has a harder time keeping those blood sugar levels in check. That screening is done to catch it early and make sure that both the person giving birth and the baby stay healthy. So let's talk about the usual timeline that comes with gestational diabetes and some of the basics that come with the test. First off, most providers that you're with, midwives and doctors, will recommend the screening happen between the 24 and 28 weeks of pregnancy, right around the time that the insulin resistance kind of tends to peak. The first test is typically a screening, not a diagnosis. So if the numbers come back elevated, it doesn't mean there's a diagnosis of gestational diabetes. It just means that there needs to be a follow-up test. And that is used to look a little deeper into if you have gestational diabetes or not. And that would normally come with a diagnosis. So the screening usually involves drinking a very super sweet drink. Normally contains 50 grams of glucose. Whew. You wait 1 hour, and then you'll have your blood drawn to check how the body processed that sugar, which was intense, okay? Your poor body. Let's think about it. So some people have a lot of concerns about what's in the drink and if they have to take it. So that's where I'm going to tell you that first off, many folks are not told that they actually have a choice because it's very common. They have a setup in place. They don't want someone to come in and ask if there's choices. It's not a restaurant, right? But the most common drink is called glucola, which contains the 50 grams of glucose and comes in flavors like orange, lime, and grape. It's often described as tasting like a very flat soda. Although it's said to be safe, it's FDA approved, some people may feel jittery, nauseous, or maybe just plain awful after drinking it. Some also have concerns about the ingredients that are inside them. Glucola may contain food dyes or preservatives, depending on the version, and that's where alternatives come in. What are your choices? Let's find out. So, there are a couple of options I know of, and I always recommend to everyone, especially my clients, that if you can read one book, read a Lily Nichols book, read The Real Food for Pregnancy or The Real Food for Gestational Diabetes. Those are my absolute favorites. I'll place them here on the screen. So, some of the test options are, firstly, the fresh test. It's a newer FDA-approved alternative. I'm still unsure if it's just in the US or if Canada also is having this option, but it contains 50 grams of glucose without the artificial dyes or preservatives. It comes in mint lemonade flavor, premixed, or powdered. And it's generally considered gentler on the stomach, and many people report feeling less jittery and sick afterwards. Now, some clinics offer the fresh test as an option, but sometimes they want more money. Now, again, that could be more American, less US, or more American, less Canadian. I am unsure. I'm still trying to find this out and contacting different hospitals. So it's always a good idea to ask your provider in advance if they have this option available to you. And if you could even get it from the States, they order it and import it kind of thing, would they allow that? That's those two options there. So for those who don't prefer sugary drinks, maybe don't even consume sugar that often, Maybe you're preferring a more food-based approach, and this is something Lily Nichols talks about in her book, is about some providers may be open to self-monitoring protocol. So this involves using the glucometer, just like when you have diabetes, to check your blood sugar levels at home. This is usually done twice, once before the meals and after the meal, and it's done several days in a row. This idea is to get a real-life picture of how your body is currently handling the glucose that you're doing on a daily, day-to-day living process. Some providers recommend wearing a continuous glucose monitor for a set time. The number of days and frequency of this test depends on the provider, but it typically ranges from 3 to 7 days. So, this method does require more involvement and a lot more work, but many people will feel that it gives a more accurate picture, and it could skip the sugar drink entirely. There is also chatter online about something of grape juice or jelly beans. Now, if they match the 50 grams of glucose level, maybe it works. Some midwife practices or holistic practices might accept this. These methods aren't wildly researched or considered reliable, so that's why most traditional labs won't allow it. So if this is something you're curious about, you definitely want to get a talk going with your doctor or your midwife and ask them what options are available to you. Honestly, I always suggest speaking to your healthcare provider and be an advocate for what you want and why you want it. Only you know what is best for your body, and thinking about a certain way that could be beneficial for you might be important. So know that you can ask questions, explore your options, because some providers might just default to the glucola without even mentioning alternatives. So if you're interested in the fresh test or the at-home monitoring or even the jelly bean one, you want to bring it up before your 24-week appointment. Make it a conversation, and don't just expect that bringing it up once will be fine. Because if it's brewing in your mind, you'll want to talk about it. But on a last little note, I'll talk about if you fail the screening. So first off, try not to panic. If you fail the 1-hour screening, it does not mean you definitely have gestational diabetes. It just means that your body might need a closer look. And in that case, your provider is going to schedule a 3-hour diagnostic test, which normally involves fasting, drinking the sugary drink or your other options, and having blood drawn several times to track how your body handles the sugar over a few hours. Again, this test would be diagnostic. It just gives the clear yes and no, rather than just the screening result. Pregnancy is full of decisions, big and small, and the more informed you are, the more confident you could feel. Whether you choose glucola, the fresh test, or self-monitoring, whatever matters you choose. The most important thing is that you're supported and you're involved in the process. And remember, knowledge is power, especially in pregnancy. Thank you so much for watching another video of mine. I so love to make them and I so love to educate. So please make sure to subscribe to find more tips like these. Give it a like, boost it with your friends. If you think they'll need to know this, then I'm sure they do. Peace!